I chose Baylor University in Dallas, Texas, because I suffer from severe sciatic nerve pain in my ankle. Choosing a medical provider was a pretty easy process. I pulled up a list of providers online that my insurance company provided to see who was in network. I narrowed down my search to female doctors because that is what I prefer. It listed how long those doctors have been practicing and where they graduated from. I was also able to see the doctor's pictures and credentials. I went even further with my research to get reviews from past and present patients on healthgrades.com. This rating system is based on 5 stars. Since I'm new to the Dallas area, I didn't know anyone, so I had to rely on the feedback of their patients, which included past and present ones. Health Grades was very informative. You select a specialty, city, state, and go from there. The more positive the comments were, that's who I decided to go with. I looked for a provider that was at Baylor University because I live less than 30 minutes away. There's a lot of traffic in Dallas. Since I live such a short distance to Baylor, my 30-minute commute could end up being an hour or more. Distance was certainly a factor when looking for a doctor, clinic, or a hospital. I also researched Baylor University's orthopedic department online. They have the top-notch doctors in the United States, and several of their patients travel from all over to see them, which I was very impressed with. That says a lot about a facility if your patients are coming from several hours away to see you. This facility is a teaching hospital, which means that the residents come here to complete their residency. I don't mind a resident coming into my room with an attending to learn more about what he or she is going to school for. But that does tend to make your exam pretty lengthy. So I think, if you don't mind someone coming into the room with the attending, especially to learn more about what they're going to school for, that should be okay. I really don't mind that because I don't want my doctors to rush when they do an exam or talk about my medical history. I want my doctors to be very thorough.